Okay, I wanted to give an update on our, you have to excuse the way I look. I actually have a day where I'm at home and I've kind of slept in, and it's, I think, which I usually don't get to sleep in, but it was nice today. But anyway, before my lines disappear, I wanted to update. I haven't even got out of my pajamas, my robe, or anything, but I'm doing the video anyway. This is a video concerning a follow-up after my husband's vasectomy reversal. We got the okay from my doctors and his to go ahead and try to start getting pregnant. He had passed the 21-day mark yesterday from the vasectomy reversal. And since my ovulation time was going to be this weekend, today's Thursday. So we thought, well, let's see if we can go ahead and try to conceive. Now, I did the ovulation test. I've been doing it this week, and today I got 2 lines. I don't know if you can see it. I don't know if the video camera is picking that up at all. But the other days there was just 1 line. So based on what this is telling me, and so we're trying to conceive, the directions that I should be ovulating in the next 24 to 36 hours. That is a double line. I mean, I don't know if the video will pick it up, but I see it. So, and I went to my OBGYN Tuesday, and she said that it felt like I was ovulating on that right side when she did my exam, and that everything looked good, and for us to go ahead and, have fun this weekend and try to get pregnant, or this week. So, and I was a little nervous because Joe was still trying to heal from the hematoma on the right side where they did the vasectomy reversal, but it had went down. It's almost normal size. The bruising is completely gone, and basically it was okay for him to go ahead and try, and he said he didn't feel any pain or anything. So we had a really nice time last night. I don't know if I'll get pregnant or not, but we did the baby dance, and I think we're going to try tomorrow and do some baby dancing, maybe Saturday. But anyway, this tells me I have 24 to 36 hours. I don't know, because based on, I have an app on my Kindle that says I should ovulate Saturday. Based on this, I should ovulate Friday. But my gynecologist, who was checking my ovulation, said, I could ovulate Friday, Saturday, or Sunday, based on what she was looking at. So to go ahead and about every other day this whole week / weekend to do some baby dancing. So that's what we've been doing, or that's what we did yesterday. We're gonna do it again probably tomorrow night. That way we're kind of almost Saturday, a little bit on the tail end of Friday. Now, when we baby danced, there was Joe. He said he had no pain. Everything was great. Because I had read that sometimes the first few times after a vasectomy reversal there's pain. He said there wasn't. So the other thing that we tried to do is, some friends had said to do the scoping, so we got a microscope. And we tried to get a sample or 2, but we were more concerned. But, we didn't really focus on that to see if there was any sperm. We just really enjoyed baby dancing, being with each other and reconnecting, because it'd been a month. Well, not a month, but, 3 weeks. Close enough. And so, we tried to see if there was any sperm by scoping, and we don't know what we're looking at. I mean, I'll just be honest. You can see stuff in the microscope, but what is it? I mean, I don't know. But I think it's not the greatest microscope either. We don't know if the surgery's a success yet. When they did the surgery and they did the sperm test, there was sperm, and they were all healthy, and everything looked good. But, I don't know if because he had the hematoma or having a little fever there for a few days, even though he was on antibiotics and he started taking zinc and calcium and vitamin C. I don't know. He may have scarred back down. But we're going to keep trying. Well, he actually have an appointment. This is our first cycle, our first attempt since the vasectomy reversal. We have an appointment the 26th to go to, it's called Preg here in this area. They serve a few states in this area. And it's an infertility place where they deal with male and female infertility. Our appointment is the 26th of this month, of February. There will do a formal sperm tests, or, you know, we'll see. Sorry, my hair's in my face. Either way, we thought we'd go ahead and give it a shot and try this month. So, you know, that's what we're doing. And it gives me a good chance to figure these things out, these sticks. Because, you know, like I said, the rest of the week I had been peeing on these. And it would have one line, or sometimes no line, which I think was a faulty test. I mean, you know, how can you mess up peeing on a stick? Well, you know, maybe you can, I don't know. But today I'm happy because I got the 2 lines, which tells me that I am ovulating soon. I don't know. What else we did, and we had been told to do by a fertility place, and I'm going to open this. I'm going to show you. This is called it may be backwards on the camera, but it's called the Instead cup. It's almost like the Diva cup. I think I'd seen it, but, well, it's shaped a little bit differently. And one of the physicians, and I'm going to open one, you're supposed to use them on your period. But one, I forget who, one of the physicians we had talked to had said, use these. Go get these. Told me where to get them. I didn't even have a clue what they were. It may have been the gynecologist. I don't remember because we've talked to so many about this. And they look like this. It's basically like a diaphragm for your period is what it looks like to me. And but they said to use this after you do your baby dancing, sex, okay? To use this, and you slide it, you close it like that, and then you insert it, and then it caps over the cervix, and then you keep it in there for like 12 hours, and it's capped over your cervix. There's directions right here, and it will show you. I don't know if I'm allowed to show this on the video or not. It'll show you though. I mean, it caps over your cervix. I'm afraid to show it because I don't know if I'm allowed to. But it shows the uterus and it caps over the cervix to hold. It works like a reverse diaphragm is what I think. It holds the sperm around the opening of the cervix after you've had intercourse so that it can't leak back out, and it's there longer. It gives the sperm more of a chance to get to where they need to go. Now, so I've used this, or we used this after we baby danced, and I slept with it. And I hope that if there were any sperm, and I don't know for sure yet because I don't know what I'm looking at under the microscope. I mean, there was when they did the surgery, when they reversed it, but I don't know if he scarred back down. So we're going to pretend that there's sperm there and pray and hope that there actually was. And hope that he didn't scar back down. So we used this afterward, and I slept with it in. What we also used is, I'm over 35, and sometimes you can have cervical mucus problems. And I have found that since I hit 35, and I'm almost 37, that I don't have as much cervical mucus, which I had read that's kind of normal for some women after 35. I could be completely wrong on that. My doctor doesn't seem to be worried about it and recommended that we use, and I left it over here, and I'm going to get it. 1 second, so I got to move. Don't look at the mess on my dining table. I'm sorry, but anyway. Okay. It's called Preseed, and not only if your husband or you, either one, has a problem with volume, like whether semen or whether if you have cervical mucus problems, don't use regular oils or lubrication out of the store. they recommended Preseed, and it doesn't kill sperm. Is what it's what it says. It's a little tube. It comes with these little applicators. There'll be directions in it, but it comes with the little applicators that you put the fertility friendly lubricant in here. Then you put it inside near your cervix, okay, and it gives you that extra fluid for so the sperm don't get stuck, I guess. I'm not saying it right, you know, but the gist is we use this, and, you know, because there's a lot of oils or lubricants that will kill your sperm. And they have a hard enough time, the semen have enough time, the sperm have enough time, hard enough time with the acidity of the vagina anyway. So you don't need to make it harder on them. So we use this and this. And we'll see. I don't expect to get pregnant the first time. And there may not be sperm. I don't know. We saw something in the microscope, but I don't know what. It's a cheap microscope. I had read online when you use the scope to get a 400, at least 400 magnification, and we got, it was like 100, 450, and like 900 magnification, but it was just a cheap Walmart microscope. And although we could see stuff, we didn't know exactly what we were looking at. It wasn't like when we went to the surgeon's office and they did the sperm test, you know, their microscope, of course, was like a medical microscope, and I could see, I knew what I was looking at. This just looked like dots. And so I don't know, and they weren't moving, really. But we kind of did the sperm thing after the baby dance, you know, with, the point is, I don't know if there's sperm. We pray that there are, we hope that there are. Because there was sperm right after the surgery, we hope that there's still sperm. And that he healed well. We'll see, because we'll know more about that the 26th. But we thought, I didn't want to miss this cycle just in case we had a chance. So we're trying. I know I'm jumping around quite a bit, and I didn't plan this video at all, but when I peed on my ovulation stick and it gave me 2 lines, I thought, you know what, I really want to document at least this first cycle, and see if we get pregnant, yay. If we don't, at least someone can see what we have done. You know, use your ovulation tests. But I also have an app, and I also went to my gynecologist Tuesday, like right before my ovulation cycle, so she could tell me what it looked like. You know, I mean, how, you know, did she think I was ovulating? And then we used the Instead cup, and you might be able to use, I think it's called the Diva cup, something. And I just slid it in. It goes on the cervix. I know I'm repeating myself after baby dancing, and I slept with it, you know. And it just keeps them there longer. It gives them more of a chance, time-wise, to go where they need to go. And you may not have the issues that I have. You know, I think that's related to me being over 35. Oh, and then the Preseed. And you can get this. We got ours at Walgreens. Like Walgreens. Some CVS's or something like that may have them, but Walgreens is where I got this. So, there you go. So, I will let everybody know. We'll continue baby dancing day after tomorrow, and there you go. Or this weekend. You know, we haven't decided for sure. I think we're kind of just relaxing, you know, see what happens. It's not in our hands, you know. We'll do what we can, but ultimately it's we'll see what we see. So, okay, I think that's all that I'm going to talk about on this video. Was there anything else that I wanted to talk about? No, I think that's it. Okay, I'll let everybody know if it did or didn't work. I'm not going to get my hopes up. I don't think it's going to work this time because I'm not sure, you know, that there was sperm. And even if there were sperm, I'm not sure with the mucus issue, the cervical mucus. You know, I remember ovulating a few years ago, and it'd be really thin and really long and stringy, not to gross people out, but that's how it's supposed to be, like egg whitey. And now it's just really thick. Oh, the other thing that I did for the last 2 days, 2-3 days, is I've started taking guaifenesin to thin out the mucus. And it kind of has worked, but it's still pretty thick. So that may have hindered any chances, even if there were sperm, for me to get pregnant. I'll let anybody know. I'll let everybody know. Okay. Until my next video.